Mr. Johnson, please come this way for your initial screening, sir. First door on your left. What seems to be the problem today?
I have a headache.
Who is your family doctor?
Dr. Obama.
And how long have you been his patient?
Nearly 10 years.
Well, sir, since you have been seeing Dr. Obama for 10 years, you should know that he no longer sees patients at this hospital.
I understand that, but I didn't feel like driving the extra 20 minutes to the hospital that he uses now, so I just came here.
You realize that even though you came here, you cannot be accepted to this hospital. And in the event that you actually do have a medical problem and need to be admitted, you will have to be transferred to the other hospital.
Yes. That is what I have Medicare for.
Are you allergic to anything, sir?
Yes, Stadol, aspirin, penicillin, ampicillin, Tylenol, and ibuprofen. What always works on my headaches is a shot of Demerol and Phenergan. That is the only thing that helps me.
Okay, so how long has your head been hurting, sir?
Nearly 2 weeks.
Have you seen your family doctor about this problem?
No.
Are you a retard?
What?
Are you a retard? Do you have some sort of mental incapacitation that could somehow justify your having come to the emergency room tonight?
Why would you ask me something like that? You are supposed to be a healthcare professional and be sensitive to my medical needs.
Sir, it is 3 o'clock in the morning. The doctor just got to sleep an hour ago and has been dealing with ignorant shit like this since 7 a.m. According to your own statements, you have had this headache for 2 weeks and never felt the need to be seen by a physician. But now you feel it necessary to wake up a doctor in the middle of the night to whine about it.
Well, my stomach started hurting about 2 hours ago too.
So now your stomach hurts too. Why did you not mention that before now?
I didn't think about it.
On a scale of 0 to 10, with 0 being no pain and 10 being the most excruciating pain you could ever dream of, the pain that you would imagine you would be in if I took my pen, stabbed you in the stomach to make a hole, then used a pair of dull, rusty scissors to open that hole up large enough that your internal organs could spill out on the floor. How bad does your stomach hurt?
About a 9.
Why am I not surprised? Okay, let's go to your medical history. Do you have any other medical problems?
Not as I'm aware of.
No heart disease, COPD, or CHF.
What is that?
That is a no. If you had either of them, you would know what it was. How about high blood pressure?
No.
Ever had any seizures or strokes?
No.
Migraines?
Oh yes, I have horrible migraines.
Arthritis?
Yes.
Are you sure you have arthritis? You are only 20 years old.
Oh yes, I have had it bad since I was 13. Something about being a teenager must have caused it.
Are you diabetic?
No, but I have sugar problems.
Do you take pills to regulate your sugar?
Yes.
Then you are diabetic. Have you ever had any type of cancer?
That could be why my stomach started hurting.
Maybe. Are you pregnant?
What?
Are you pregnant?
Are you being serious?
Yes, sir.
How can you seriously ask me that question? I am a man.
That is what you say, but I have seen no proof of that so far, sir. The fact is that you have come in here complaining of a headache and abdominal pain, and quite frankly you have been quite about the whole ordeal. And on top of it all, I am having trouble believing that you actually have the intelligence to determine whether or not you are male or female. So I am going to ask you again, sir, are you pregnant?
I don't know.
You don't know?
No.
Okay, when was your last menstrual cycle?
I don't remember.
Okay, sir, I will put that down for your answer so that the doctor will know to check before he does any x-rays. We don't want to take the risk of causing problems with the developing baby in the event that you are pregnant.
Thank you. I appreciate your concern.
That's no problem, sir. We are healthcare professionals here and have nothing but your baby's best interest in mind. Who knows, that could have been what happened to you that has caused all of your mental incompetence.
What?
Never mind, sir, I was thinking out loud.
Oh. I have never done that before.
I'm sure you haven't, sir. Now all we have left is to get your vital signs, and you can go back out to registration and they will finish your paperwork so that you can get started creating the enormous bill that those of us with a job will ultimately have to pay.